Hello and welcome to everyone joining us today for this discussion on the future of employer-sponsored insurance. More than half of Americans receive their health insurance through work. However, research we've done at Gallup with our partners at West Health finds that employer-sponsored insurance faces major challenges for businesses and workers alike. Over the past 2 decades, employer-sponsored health insurance premiums and deductibles have only increased. These rising costs impact business competitiveness, they stretch household budgets, and they also force businesses to be more tightly strapped instead of investing in their own businesses to cover costs. While employers bear the brunt of the expenses, millions of Americans with employer-sponsored insurance still have difficulty affording healthcare expenses. Today, we'll be sharing new data on levels of public support for the federal government to play a bigger role in reducing the financial burden of healthcare among both business leaders and everyday Americans. We'll also be joined by healthcare experts and leaders from West Health for a discussion on the future of employer-sponsored insurance. And what I'm most excited about, we'll hear about some real-life stories from everyday Americans about the challenges they face as they attempt to access affordable healthcare. I should mention this program will be available for download shortly after the conclusion of this hour. And on behalf of Gallup, I really want to thank West Health for supporting this research and bringing these voices of everyday Americans to one of the nation's greatest challenges. Now, it's really my pleasure to introduce a very special guest, West Health President and CEO Shelly Lyford, who will be making some opening remarks to get us started. As president, Shelly oversees West Health's family and nonprofit and nonpartisan organizations that are dedicated to lowering healthcare costs and improving the lives of the nation's seniors and all Americans. Shelly, the floor is yours, ma'am.
Great. Mohammed, it's always such a pleasure. Thank you so much for that kind introduction. If you're like me, and about half the country, you receive your health insurance through your employer, a long-cherished benefit that comes with the job. But even employer-sponsored health insurance is no shield against higher and higher premiums and deductibles, and certainly no shield against the skyrocketing healthcare costs and prescription drugs. Over the past decade, the average premium for a family has increased a whopping 55%, nearly 3 times the rate of inflation, and more than twice as fast as wage growth. This financial burden is crippling. Americans are staying in jobs they do not want for fear of losing health insurance. And worse, millions of people are skipping necessary treatments, getting sicker, and even dying because they cannot afford health care. At the same time, businesses are being forced to cut back on investments, capital expenditures, and other essential expenses, including hiring and salaries. Every extra dollar spent on healthcare is $1 less for wages. But let me be clear. It is not that spending on healthcare is not important and should not be a priority. It's simply that healthcare costs too much. The situation has become untenable. As we will hear today, businesses, both large and small, cannot keep pace with ever-increasing prices. Many small businesses have diminishing bottom lines due to their higher healthcare costs. And executives at nearly 90% of large employers believe the cost of providing health benefits to employees will become unsustainable in the next 5 to 10 years. Not good news for the 158 million Americans who depend on employer-sponsored insurance to blunt some of these costs. This is the state of healthcare for American business. Our high-cost system is broken and in need of desperate repair. But those repairs are being stalled by industry lobbyists who wield so much power that nothing ever seems to get done to lower prices. But the situation is not hopeless. When the business community speaks, Washington listens. We've seen it happen before, and we can see it happen again. In one of our recent surveys, 90% of Americans support major reforms to our healthcare system over the status quo, including 96% of Democrats, 88% of independents, and 83% of Republicans. Clearly, this is not a partisan issue. This is an American issue that requires a response from big and small business alike. This is just too important to leave solely to politicians. During today's discussion, we will explore some of the way costs are hurting American businesses and employees. We will begin by shining a light on how this impacts the engine of the American economy, small businesses, which represent 99% of all employer firms in the country and account for roughly half of the nation's jobs and economic output. When employers suffer, our entire economy is jeopardized. I'm pleased to be joined by Heather Whaling, the owner of Gebin Communication in Columbus, Ohio. Heather is one of the nation's 30 million small business owners and has navigated the complexities of providing her employees with health benefits for over a decade. Despite the financial impact, she remains committed to offering her team health insurance. Like many small business owners, in order to keep up with rising healthcare costs, Heather has elected to take less profit. Heather, thank you for joining us today.
Hi, Shelly. Thank you so much to you and West Health and Gallup for having me and for elevating the voice of small business in this conversation.
Heather, I'm so happy that you're here. Before we get into our questions about the high cost of healthcare, tell us, what does Gebin mean?
The word Gebin means to give in German. When I was naming the company, I wanted something that related to me, but I didn't want it to be my name. And my family is German, and I'm a big believer in the power of nonprofits in the community and the responsibility that businesses have to do good in the world.
Oh, that's excellent. So I'm sure that thesis and that philosophy and framework has motivated a lot of your business decisions. So let's talk a little bit about those decisions. First, tell us about Gebin Communication and what inspired you to launch your own business, and was having health insurance a consideration as you started your business?
It goes back to about 2009. I'd been living in Orlando, working at an agency for about 5 years. And this is when around traditional and digital communication were starting to converge. Social media was a thing clients were starting to ask about. And I knew there was an opportunity there to build business around that integration of traditional and digital PR. I also knew that I wanted to move back to Ohio, where I'm from. But if you remember back in 2009, it was sort of the height of the recession. So there weren't exactly a lot of companies hiring, and they certainly were not hiring PR people. I'd been getting some offers to do consulting, which gave me a little bit of assurance that I could maybe go out on my own. So I decided to take the leap into entrepreneurship in 2009. I quit my safe, steady job, started a business, and moved to Ohio, all within a short period of time. And in thinking back about that situation and the decision-making, to be honest, the only reason I was really able to leave my safe, stable job at that time was because I had a safety net. I was married to a person who had a steady job with a good salary and knew that we'd have income and we'd be able to have health insurance, even if my leap into entrepreneurship flopped. Thankfully, it did not flop. So, now I have a team of about 30 people. Like you said, we're based here in Columbus, Ohio. We're very proud to be a Midwestern company. And we have members of our team in Boston, New York, DC, and LA. Our focus is really helping innovative corporations and mission-driven brands accelerate their growth and their impact.
That's fabulous. So you talked a little bit about the safety net that you had, where you were able to make that leap into entrepreneurship. As a small business operator who's been operating for about 12 years, do you believe that providing health insurance to your employees has made you more competitive?
Absolutely. We started offering health insurance in 2013, and I think we had maybe like 4 or 5 employees then. And I knew even back then, there was no way we would be able to recruit and retain top talent without offering competitive benefits.
So with respect to those benefits and to going out and getting talent, retaining talent, have you ever had to delay investing in your business or make different hiring decisions because of how much you had to spend on healthcare?
Anytime we think about making an investment in the business, I have to consider the immediate cost as well as those ancillary costs. So when we're making a hiring decision, it's not just the cost of that individual salary. We also have to factor in the cost of benefits, the largest of that being health insurance. I tend to prefer to hire a little bit ahead of the demand. So as work increases, we always have capacity, and I don't ever want us to be in a position where we would have to turn down an amazing new business opportunity. But there are some times where I find myself on the fence about making a move, and maybe I might decide to delay it a little bit until we have more revenue confirmed so that we can offset or mitigate some of that risk. If we could bring down some of those ancillary costs like health insurance, that would then create a bit more breathing room for us and allow us to be even more aggressive in our hiring practices. We've been able to get creative with the type of plan we offer. We've moved from a low deductible plan to a high deductible plan, and we provide for a first dollar benefit on like a debit-like credit card to help our employees cover those costs. We also continue to pay 75% of our employees' healthcare premiums, including medical, dental, and vision. I think one of the things that's important, though, in this broader conversation to understand is that at Gebin, our situation is a little bit different than most small businesses. And I just think it's fair to acknowledge that. I own a professional services firm, and so our margins are pretty strong. I have the flexibility to self-fund. We provide paid family leave for all new moms and new dads, and I have the ability to self-fund that. I have the flexibility to invest in the employees by paying for 75% of their health insurance premiums. The reality is that's not the case facing a lot of small business owners, especially as they come out of COVID and numbers are crunched right now for them. So I think it's fair to acknowledge I have a lot of friends who own small businesses, and the burden of the high healthcare costs can be crushing for them. I know lots of examples of people who own businesses and work with contractors and freelancers, not because they don't have the work to justify making the full-time hire, but because they don't want to incur the additional costs that come with full-time employees, like the health insurance piece of that. And then, when you look at non-service-based businesses, margins are really tight for those companies, and they may not be able to sacrifice points on their margin. That for them could be the difference between being a thriving business or a struggling business.
Absolutely. Those points are so well made, Heather. And I appreciate that you're in a slightly different place with your own business, but you do represent small business and you understand the struggles and, like you said, how crushing the high costs of healthcare truly are for small business owners. I'd like to pivot slightly, Heather, and talk to you in your role as a woman entrepreneur. In recent years, we have significantly seen more women become entrepreneurs. In fact, over the last 40 years, women have gone from owning a mere 4% of all U.S. businesses to more than 40%, which is fabulous. Heather, you personally know how vitally important offering healthcare is for women entrepreneurs. As we emerge from the pandemic, statistics show women-owned businesses are amongst the hardest hit. Are you concerned that rising healthcare costs will delay recovery or more substantially impact women entrepreneurs?
Yes, absolutely. I think that's a reality that we have to be really honest about. And I think it's worth taking a look at that 4% statistic. So, or the 40%, you know, while women now own, I think it's 4 out of 10 or something like that, businesses, that's amazing growth, but only like less than 90% of them are generating $100,000 in revenue a year. Only 2% of all women-owned businesses are generating more than $1 million in revenue a year. So not to get too stats focused, but I think we have to look at, you know, this is a multi-pronged issue. We have to look at what are the workplace policies that are prohibiting women from staying in the workforce, like childcare, flex schedules, paid leave, all topics for another day. But then I think also today, thinking about that math, if the vast majority of businesses owned by women are generating less than $100,000 per year, think about how much of that then is being eaten up by healthcare. It creates a domino effect. So if they're spending such an outsized portion of their revenue on health insurance, it means then they're not able to invest in other strategies that could help their business grow and ultimately help them hire other people. That lack of financial flexibility and cash flow, you know, cash available, that may be what stops them from creating jobs in their communities. The other piece sorry, go ahead.
No, I'm sorry. Sorry, go ahead.
No, I was saying the other piece too, for me, I was able to take that leap into entrepreneurship because I had that safety net underneath me. Not everybody is in that position. When I started, didn't have pre-existing conditions. And so it was relatively easy for me to figure out how to get healthcare coverage. The lack of access to affordable healthcare may be what stops a potential entrepreneur from being able to take that leap and leaving their corporate job. And it may stop them from going on to build what could be the next great job creator in their community or the next great American brand.
That's exactly right. Our engine, our innovation engine. So you just laid that out so perfectly, the kind of the plight that we are in here in America. Heather, from your perspective, do you think Washington is in touch with the needs of small businesses, especially as it relates to healthcare costs?
I think there are very powerful lobbyists who don't really speak for the voice of small business. They have much deeper pockets, though, and are often drowning out our perspective. So it's why I'm so glad that this is opening up with being able to reflect on what does health insurance mean for small businesses. And I think we need to have more conversations and make sure that those perspectives of small business owners are at the table.
Excellent. I couldn't agree more. And just one last question before we turn it over to Mohammed. Heather, if you could wave a magic wand beyond having the conversations that are so important to get everyone at the table, what changes would you like to see in Washington as it relates to entrepreneurship and healthcare?
So I like to say that I dabble in policy, but I'm really not like the policy wonk. I think there's a lot of those conversations happening as soon as we're done here. But I think from my perspective, I do believe that government can help put some safeguards in place to make sure that healthcare is both accessible and affordable. I would like to see more conversations like this featuring small business owners, including women, but especially women of color. I think if we're serious about small business being such a critical piece of the economy and such a job creating engine, then our lived experiences need to have a seat at those tables.
I couldn't agree more. We have to be inclusive and we need to get to work. Let's grow that 40% to 75%. Heather, thank you so much for your time today. Thank you for your commitment. Thank you for being part of America's economic engine. Mohammed, I'll turn it back over to you.
Thank you, Shelly, and thank you, Heather. Now, let's take a look at some of the latest data we've been gathering with our partners at West Health. Because we are Gallup, I wanted to take a minute to talk to you about the methodology of the study and how we gathered it. I won't spend too much time here, but just to mention that this is an online study that was conducted between March 15th and the 21st with just under 4,000 Americans ages 18 and older. Again, this whole program will be available after this for download. So for those of you who are really interested in the methodology, you can take a closer look then. I did want to start by just pointing out that 41% of full-time workers and 54% of part-time workers told us that they were very concerned about being unable to pay for a major health event. And this was really one of the most important questions we wanted to start with in our study this year. What's really interesting is unemployed workers are the most likely to be concerned or very concerned about being unable to pay for a major health incident. And we define that in the study as basically something like a diagnosis of cancer or a major car accident. 4 out of 10 full-time workers and the majority of part-time workers share that concern. For gig workers, you can only imagine that the challenges with healthcare benefits only increase as more and more of their time is spent to raising wages that are not necessarily attached to benefits that include healthcare. Now, half of all American adults are either concerned or extremely concerned that they'll suffer bankruptcy if they were to face a major life health event. We've seen this number escalate throughout the past year, and once again, this spring, it reached record highs since we began tracking it. In our study, we define a major health event, like I said, as a cancer diagnosis or a major car crash. So we do give the respondent some sort of bearing to understand what we're talking about and make sure that we have kind of the same events in mind. Surprisingly, those who are getting insurance from their employers don't feel more financially secure than those that do. So if, for example, if you are employed, you don't necessarily have less fear or feel more secure about your health care in the incidence of a health event, even though you have employee insurance. In fact, only 1 out of 7 of those who are employed actually say that they have no concern at all. A significant proportion of American workers feel trapped in jobs they don't want because they don't want to forego their health insurance benefits. And this was truly one of, I think, the most shocking findings for those of us that are not very involved in the area of healthcare and its relationship to employment. So we're talking about people who are in a job, they don't want to stay in that job. And if you think about the job market right now, it's actually a great time to be looking for a job because employers are looking to hire, but some people are still finding themselves stuck in a job in order to just have access to the benefits that come with that job. Without government-backed healthcare, most employers are essentially beholden to their employer or their spouse's employer, healthcare benefits and situation. We also see a really disparate reality across racial groups in the United States. Black Americans are 50% more likely to remain in an unwanted job than their white and Hispanic counterparts in order to, again, hold on to healthcare benefits that they would fear losing otherwise. About 35% among workers earning under $48,000 a year say they're not doing enough. Essentially, their employers are not doing enough to bring down the cost of healthcare. The number declines as income rises, and that's what was really interesting. So there's an inverse correlation between income and satisfaction with how much your employer is doing to bring down the cost of healthcare. Higher income households are more likely to be paying for top shelf packages, as we currently see today in America's employment economy, with much smaller deductibles. That perhaps explains why they feel much more comfortable about what their employers are doing to bring down costs. In low-income households, where employment doesn't offer a lot of great benefits, we see more frustration with the employer when it comes to lowering the cost of healthcare or seeing the employer as doing their part in trying to bring those costs down. When we ask about whether their employer is acting on their own or can act in sort of a larger group, we essentially say, to what extent do you believe employers acting together can meaningfully affect the cost of healthcare for their employees compared to simply acting on their own? And this gets to, I think, the point that Shelly and Heather were talking about just a few moments ago about how policy changes really are where the rubber meets the road on some of these challenges. 40% of Americans said that their U.S. employers organizing together could help to a moderate extent. 34% say to a large extent. But what's really important, obviously, is that the majority see more power in group organizing on this topic. And finally, we just wanted to ask Americans and get a sense of where they were on a series of initiatives that the government could take action on to reduce prices on drugs and healthcare services. More people agree than disagree with various proposed mechanisms, and you see them sort of listed to the left there, by which the government can step up to curtail costs. However, the more important point to note is not necessarily how many Americans think that's a good idea, but really the intensity, comparing those that strongly agree and agree to those that strongly disagree. There certainly is a lot of intensity and overwhelming support for action on this front. From the government's perspective, from the government side, on everything from access to drug price increase, setting limits on drug price increases, capping prices for hospitals in certain markets, all the way down to establishing limits on prices charged by out-of-network care. So with that, I want to move on to our consumer speaker story, and something I've been extremely excited for us to share with you all today. It's really my honor to invite Carolyn to the stage to tell her healthcare story. Carolyn is a lifelong Alaskan who works in the resource development industry in Alaska. Last year, Carolyn gave birth to her daughter, Madison, who was born with a complete atrioventricular septal defect and had to be repaired by open heart surgery in Seattle's Children's Hospital. Maddie also has Down syndrome. While both Carolyn and her husband work a lot and have private insurance, many of Maddie's needs have not been covered by their providers, but they've been able to gain access to affordable health care through Denali Kid Care, which is Alaska's Medicaid program for children. Carolyn, thank you so much for taking the time to share your story with us. The floor is yours, ma'am.
Thank you for that introduction. As stated, my name is Carolyn Allen. I was born and raised in Anchorage, Alaska, which is still my home today. I have been a project manager for 12 years with the same company. Most importantly, I am the mom of two beautiful children, a 4-year-old boy, Nate, and a 9-month-old little girl, Maddie, and I'll be talking about Maddie today. About a year and a half ago, I received a prenatal diagnosis that Maddie likely had trisomy 21, also known as Down syndrome. The fear and anxiety that I felt through my pregnancy can't fully be described. I was initially devastated, not understanding what that would mean. When she was born on September 22nd, 2020, her diagnosis was confirmed. However, when I met my little girl that day, when I saw her big cheeks and her beautiful blue eyes, I was relieved. I inherently knew at that moment that she could and would change so many people, starting with me. Even though I knew that Maddie wouldn't let anything hold her back, she has already had some major challenges to overcome. First, Maddie was diagnosed with an atrioventricular septal defect, a congenital heart defect that would eventually cause her to go into heart failure and would need to be surgically repaired by 6 months of age. She had low oxygen levels, difficulty feeding because of low energy, and low weight gain due to her heart failure. In addition to Maddie's heart condition, she has low muscle tone, which is a major hurdle for people with trisomy 21. Maddie started physical therapy at 1 month old and occupational therapy at 3 months old. In Maddie's first month of life, I did the same thing that I had done with my son. I started working on adding her to my employer-provided insurance. I have had excellent health care through my employer, which is a key reason I have stayed with them for so long. Until having Maddie, my insurance had always covered the majority of medical bills for my family. This is not the case with Maddie. After Maddie's first physical therapy session, I was told that my insurance would only cover 20 therapy sessions per year. This includes all therapies: speech, physical therapy, and occupational therapy. Just for physical therapy, if she attends once a week for a total of 52 sessions a year, 32 sessions wouldn't be covered. Within the next year, Maddie is scheduled to start occupational therapy weekly and starting speech therapy. This increases it to 136 sessions not covered. At that time, I was told to apply for Medicaid, which shocked me because I've always known Medicaid to be for low income. Without this state program that is funded for children with disabilities, I would be paying between $10,000 and $40,000 just for Maddie's therapy. Before I pursued Medicaid, I looked into adding Maddie onto my supplementary insurance that I've had for years. I was informed during that phone call that Maddie's congenital heart defect is a pre-existing condition, and they would cover her after I paid for increased rates for an entire year. I also later found out that until the Affordable Care Act was passed, she could have been denied by all insurance companies, including my employer-provided health care, due to her heart condition. In addition to her therapies, I was not covered for travel to or lodging in Seattle when we went there for her surgery, even though Alaska has no pediatric heart surgeons. We were there for 2 weeks in the hospital and an additional week afterwards for her first post-op appointment. A plane ticket from Anchorage to Seattle is about $300. For an inexpensive hotel, I would have paid between $500 and $1,000 just for the week after surgery. I have been extremely fortunate to have the healthcare that I have through my employer, but my current insurance alone won't help my daughter grow and develop as she has the potential to. My daughter deserves all of the opportunities that my son does. Inclusion is so often talked about as parents, so I'd like to close with the definition of inclusion from the National Down Syndrome Society. Inclusion is a philosophy based on the belief in every person's inherent right to fully participate in society. Inclusion implies the acceptance of differences. It makes room for the person who would otherwise be excluded from experiences that are fundamental to every person's development. Thank you.
Carolyn, I cannot thank you enough for sharing your story with us. It's, so much more powerful than any report or research or data. Thank you for having the courage to share it. And it's a perfect segue, really, to dive into our conversation with our experts to find some solutions and suggested outcomes that are better for American workers and the American public. We're going to hear from an esteemed panel of experts who will dive deeper into the questions and also the data I presented. Our first panelist is West Health's Chief Strategy Officer and Executive Vice President, Tim Lash. Tim oversees the development and execution of West Health's successful aging portfolio across its nonprofit applied medical research, policy, and outcomes-based philanthropy. Next is Larry Levitt, Executive Vice President for Health Policy at the Kaiser Family Foundation. Larry oversees KFF's policy work on Medicare, Medicaid, the healthcare marketplace, the Affordable Care Act, women's health, and global health. Our next guest is John Arensmeyer, founder and CEO of Small Business Majority. John has used his long experience as a business owner to build Small Business Majority into a nationally recognized small business organization focused on empowering America's diverse entrepreneurs to build a thriving and inclusive economy. And finally, it's my pleasure to introduce your moderator for this discussion, Dan Gorenstein. Dan is executive producer and host of the podcast Trade-Offs, which focuses on the intricacies of healthcare in America. Dan, the floor is yours, sir.
Mohammed, thank you so much. And I just want to echo your appreciation to Carolyn real quick. Carolyn, thank you for sharing your family's story and Maddie's journey. The challenges that you face are palpable. It's real, and really appreciate that. Okay, and thank you to West Health for having us. I'm really excited about this conversation. I'd like to start off with a question for you, Larry. During the pandemic, we saw lots of people lose their jobs and with it, their insurance coverage. What fault lines did COVID reveal about the U.S. healthcare system, particularly around employer-sponsored insurance?
Well, thanks, Dan. I mean, as you said, we saw massive job losses, particularly early in the pandemic. And that's the kind of shock that, could really change the really reshape health insurance and employer-based insurance in particular. causing us to rethink the role of employers in the healthcare system. Now, the health insurance losses were actually, fortunately, not as great as you might have expected, given these massive job losses. And that's true for several reasons. One is that many of the job losses, particularly early on, were temporary, and many employers continued health insurance for their furloughed workers, expecting them to come back. They didn't come back quite as quickly as I think many people expected, a year and a half ago. But health insurance continued for many workers. Second, and maybe not so fortunately, is that the effects of the pandemic-fueled economic crisis were incredibly uneven, and this is some of what Mohammed talked about in terms of low-wage jobs versus higher-wage jobs that come with benefits. Many of the workers who lost their jobs were low-wage workers and didn't have health insurance to begin with, so they didn't have any health insurance to lose. And then finally, and I think this is the most important reason, is we had a safety net in the Affordable Care Act for the first time in a recession. And, the ACA and Medicaid, which was expanded as part of the ACA, and some of what Carolyn talked about for Maddie, was there as a safety net and really did its job, picking up the people who lost their employer-based health insurance, which numbered in the millions. So I think when all is said and done, we're going to look back and find that not a whole lot more people, in fact, maybe no more people, were uninsured because of the safety net that existed with the ACA. I think also, we saw this kind of seismic shift in healthcare costs during the pandemic as people skipped and delayed care. It's ironic to think that it took a pandemic to lower healthcare costs for the first time ever. Now, hardly a long-term sustainable solution. I don't think we can assume that the pandemic permanently bent the cost curve and we can all just go home and declare victory. And in fact, in a survey we did with earlier this year with support from the West Health Institute, found that overwhelming majority of corporate executives, 87% of corporate executives, feel that the costs of employer-based health insurance will be unsustainable over the next 5 to 10 years. And coming out of the pandemic, we could see real pressures. And we heard some of this earlier. Employers are being forced to raise wages to attract workers. Healthcare costs are starting to rise more quickly, adding to compensation costs as well. And this is for businesses that are, seeing very low margins, have seen very low margins for months and months due to the pandemic. So in that survey with corporate executives, we found, really surprising support among this pretty ideologically conservative group for government intervention to control costs. I mean, the kind of things that Mohammed talked about, the public supports as well, negotiation of drug prices, capping hospital prices. So, we could see, I think we're seeing a real shift in how employers and executives are viewing healthcare.
Thanks for that, Larry. I appreciate that. And that's actually a wonderful place to jump into a question for you, John. Look, it's clear small business owners rely heavily on the exchanges. It's a point that you've made previously. Why have they become so important for small employers? And to Larry's point about this shift, has their importance grown during the pandemic?
Well, absolutely. First of all, I want to thank West Health for hosting this forum, and thanks to Heather and Carolyn for sharing their stories. Pre-ACA, although more than 50% of all businesses offered employer-sponsored coverage, less than 50% of small businesses did. That is a number that had been dropping. And the exchanges all of a sudden created a real alternative, particularly for businesses with lower income employees who could get the subsidies in the exchanges. The fact that most people don't realize is that over half of the participants in the exchanges are either small business owners, small business employees, or self-employed people. That's 5.7 million people, and countless millions more are covered by the Medicaid expansion that Larry talked about. So the ACA has, on the one hand, has really expanded the opportunities for coverage. This has become even more critical since the pandemic because a lot of people lost their jobs, and believe it or not, 4.4 million new businesses have been started in the last year, many by people who have lost their job. Now, not all these businesses are going to survive and continue, but all of a sudden, with these new, very small self-employed people and small businesses coming online, the exchanges are going to be even more important. Fortunately, the increased subsidies and the extended enrollment period in the American Rescue Plan have been a major help to small businesses and their employees. But this is counteracted by the fact that, as Larry said, healthcare costs have just continued to rise dramatically. So I'm happy to get into some statistics that we did in a recent survey we did with Families USA on the attitudes of employers toward healthcare costs. I don't know if you want me to do that now or later in the panel.
Thanks, John. Sure. Why don't you give us a quick little overview of that real quick, please? Thank you.
Thumbnail. This is a survey we did earlier this year and released with Families USA. 47% of entrepreneurs identify healthcare costs as being one of the two big barriers to maintaining or growing their business. 34% say they've struggled to obtain health coverage for themselves and for their employees. But that number is dramatically higher for businesses run by people of color. 50% of Black-owned businesses express the same feeling. 44% of AAPI-owned businesses and 43% of Latino-owned businesses. So while there may be alternatives with the exchanges, the pressure of costs has gotten even greater during the pandemic. 16% of those surveyed said they've made changes to their healthcare coverage just to keep their businesses open. So yes, cost has always been a huge factor, and it's become even more dramatic as a result of the pandemic.
Thanks, John. I appreciate that. Tim, I'd like to turn to you here. Clearly, even in this conversation, and certainly the data that's been collected between West and Gallup, we're seeing a trend here. Historically, employers have been reluctant to seek out help controlling costs from lawmakers. Yet in this new West Health Gallup survey, it seems like that attitude is shifting. That's something that Larry just talked about a couple of seconds ago. Based on conversations, Tim, that you're having with employers, do you have a sense what seems to be driving this sort of change of heart? Is it, as John suggested, cost? Is it more than that?
Great question, Dan. It's great to be here today. I think it is a true statement that the position has shifted as it relates to the engagement of the business sector with lawmakers. But this is not the first time at the rodeo for businesses as it relates to engagement around healthcare costs. And I really do think that the journey that we've witnessed, even over the last, 3 decades really yields important learnings, right, in terms of where we're at today. If you recall, back in the late 80s and 90s with the HMO experience, employers were very engaged in, capping healthcare expenses and reallocating that profit to reinvest in the business. And in the mid-90s, there was a very significant backlash that really sort of, changed the tides in terms of how businesses thought about healthcare expenses. And it shifted so much, the pendulum shifted so much to the other side that in many ways, healthcare expenses and providing ESI was a ticket to the game, table stakes in many ways, to attract a competitive workforce. I didn't fully really understand to what extent that had shifted until I'd say it was probably the conversations in the early 2000s. I was working in corporate mergers and acquisitions focused in healthcare, and at the time, lots of companies, these tech companies with Breathe programs, Jump programs, Love programs, right? Really, selling the potential to lower healthcare expenses for employers. There was a significant gap in terms of the sort of the economic impact in reduction of healthcare expenses that they were touting and the valuations, the dollar amount that employers were willing to spend, for those assets. And it wasn't until I was having a conversation with one of the corporate executives at Johnson & Johnson at the time, really understanding what they were doing. And finally, he looked at me and said, look, we call these breathe and jump and love. And, for a reason, we're really not interested in lowering healthcare expenses. These tools are, really, a means to attract talent and sort of maintain goodwill within our employee base. And, that is a really striking and stark contrast to, sort of the 90s and HMOs where, at all costs, employers were trying to consolidate that. That pendulum started to shift back, significantly before COVID. You see, a tremendous amount of consolidation in the healthcare industry. You see, in many cases, collusion, where you have the actors within healthcare, the pharmaceutical companies, the payers, even the providers, working together in many cases to maintain high prices, limit competition. That's textbook definition of a cartel, and it has, a very significant impact on the economic viability for businesses, and it has resulted in stagnant wage growth. The largest employers amongst us, those multinational companies, tried to get at it. But even Walmart, with some of their programs, couldn't beat the cartel. And we find ourselves entering into COVID, where we see very significant sort of wage stagnation. We see innovation being compromised because the cost of providing the health insurance to the employees, reaches sort of intolerable levels where it needs to be further shifted to the employee sector. And then you have COVID come along. And I think we put too much pressure on, or credit on, COVID as sort of illuminating the problem. I think COVID has illuminated some new insights as it relates to healthcare expenses and failures within our system. But really, what COVID has done is amplified the debate, amplified the urgency, and the recognition that you can't sort of go at it alone. So where we find ourselves today is, I think, a re-engaged business sector. It's not the first time they have engaged, but as businesses understand the full economic impact of high healthcare costs on their business, the longer-term impact of COVID and its impact on our economy, as they understand what we witnessed with government engagement on COVID, this hyper-parallel Operation Warp Speed approach, where we retooled our system, and it wouldn't have been possible but for government engagement, and perhaps a little bit of a desire for air cover from sort of the legislative branch. We see, I think, an increased willingness of the business community to re-engage, but to re-engage with at the table with lawmakers, in hope that sort of at this point they can, finally get at some of those sort of anti-competitive behaviors, fight the cartel with a little bit more leverage.
Tim, I really appreciate this point that you're making, the cyclical nature of employer attitudes. We have seen sort of employers get really riled up. We have seen employers sort of like, it's fine. We just want to retain talent and we're going to pay for it. We don't really care. And we're in this more acute moment. And I think that's really well said, and perhaps put some historical context on some of the survey data that you all have put together here. I'm really curious. I'd like to ask the group, and maybe Larry, I'll throw this to you first. Obviously, we're seeing, we've all been talking about this, there's this growing frustration from business owners and from workers over employer-sponsored insurance. What do you think this means for the status quo, Larry? And maybe one way to really frame that is, how different will employer-sponsored insurance, or ESI, look 10 years from today in 2031?
Well, I think, picking up on something Tim said, and Tim talked about the move to HMOs and managed care in the 90s, and that was a strong effort by employers to control healthcare costs, and it really backfired in many ways. There was a consumer patient backlash against the restrictions in HMOs. As Tim said, the whole reason employers offer health benefits is to attract quality workers, and if you're pissing your workers off with those health benefits, it's not doing what it's intended to do. And what we saw was a period of then rising healthcare costs after the backlash against HMOs, And then employers turned to kind of the only other thing they could do, which was to increase deductibles. And Shelly talked about this. I mean, the average deductible is now over $1,600 per person, which is an unbelievable amount. And that's producing another backlash. And we see that in the survey data that Mohammed presented in terms of, cost problems, affordability concerns. So even if you have insurance, if you've got a $1,600 deductible, you're going to have concerns about costs. So I think there is this growing recognition that if we want to get healthcare costs under control, prices are the only way to address that. We spend double per person of what other countries spend on healthcare, other developed countries, and the reason is we pay higher prices for drugs, for hospital care, for physician care. And employers, individual employers are largely powerless to deal with that. I mean, the only way an employer could lower the price of healthcare is to steer their workers to lower price hospitals and prevent them from going to higher priced hospitals. And that's going to produce that same backlash where, people are going to get really pissed off that they can't go to see the doctor or the hospital they want to when they're sick.
And let me just push you, though, really quickly, and just in one sentence or two here, Larry. Do you think this frustration, this growing, you talked in your first answer, you talked about you're seeing a shift. We're seeing a shift in attitudes among employers. Do you think this is new? Do you think we're actually going to see over the next decade, a real change here in what health insurance at work looks like?
I do think it's new, but I also think it remains to be seen how engaged employers really get in this debate. Employers like Heather, I mean, they're focused on their business. Their jobs is not to lobby Congress to deal with drug prices, and even really big employers who are engaged in the issue of healthcare costs. When push comes to shove, are they going to use their political capital to address healthcare costs, or are they going to use their political capital to address some issue, kind of more germane to their business or industry? And I think that's still a big question.
Thanks, Larry. And let me just throw that to you, John, real quick. I'd like to get to an audience question or two. Our time is tight here. But John, talking with your members, small businesses around the country, are we at a different kind of inflection point? Do you predict that in 10 years from now, employers will have kind of come together in some way, coalesced, and demanded a new system in some profound way?
Well, I think, look, Larry's absolutely right. The underlying problem is cost. I mean, they talked about managed care. We know our small business owners with whom we deal with, they reduce how much they're covering. They go to higher deductibles, higher copays, all sorts of things. But at the end of the day, you're not solving the underlying problem, which is cost. I don't know if this is going to change. I mean, we've been at the forefront of pushing for change ever since my organization's existed. I was kind of amazed during the run-up to the Affordable Care Act how big businesses kind of stayed on the sidelines. I'm not talking about drug companies. Obviously, they had a stake in the game, but all the businesses that were paying these incredible costs. So I don't know. I mean, there definitely is increased pressure. I think the pandemic has increased that, but it remains to be seen who's going to jump in. I mean, 90% of the businesses in our survey support policies to reduce prescription drug costs. And obviously, there's components in the president's fiscal 22 budget for negotiation with Medicare, for rebates when drug prices get too high. These sorts of things are absolutely essential to bringing down costs. We support a public option. We support more competition out there. But at the end of the day, we're there, and we have small business owners who are with us. But it's going to take the big businesses to really step up and put pressure on this.
And Dan, if I could just follow on to Larry's
please
comment on that. I think there's a real risk to inaction, right? It's always been the case from an equity or inequity standpoint that the economic value hurdle, right? The sort of the cost of employee versus the value they deliver, for low wage workers has been increasingly increasing, assuming they have coverage, and the cost of healthcare is making that equation, I think, exacerbate the inequities that travel along income lines. But we're now at a point where sort of that economic value hurdle for even mean and median income workers is also increasing. So, I realize we've been here before, and there's some questions as to, how active the business community will be. I think, but there comes a time when the problems swept under the rug nonetheless fill the room, right? And I think the room is pretty full at this point. And I think the survey results that we've just reviewed sort of yield that, across the populace, whether you're the employee or the employer, there's a recognition that something has to be done.
Thanks for that, Tim. And, all three of you, there's a lot of agreement here among the panel. And I've been scanning some of the questions from the audience. And because we're tight, I'm not going to go specifically to an audience, but try to synthesize some of the question, which is there's a real hope that some sort of public option or universal coverage type plan might help employers and move this along. And I'd like to ask you first, John, do you think there's any appetite among lawmakers to actually control costs? We know there's an appetite among employers and employees, but what about the government? Do you see that happening anytime soon? And if you could just answer this really tight, give me a 30-second answer.
Not to get too political, the pressure's there. And in the past, Republicans have joined with Democrats in feeling that pressure and trying to do something about it. But when push comes to shove, it tends to stall. And I think now we have an added political problem that Republicans are not likely to do anything that's going to give Biden or the Democrats any wins. So, yeah, the pressure's there, but we've seen this roadshow before. And it's exacerbated. The problem's exacerbated by the current politics in our country right now.
Thanks very much, John. And yes, it will be interesting to see if the building pressure and the momentum that exists right now does persist and leads to some sort of real meaningful shift. I would like to thank the panelists for a very informative discussion and thank you all for participating. Thanks for sending in the questions. I'm sorry we didn't have a little more time to get at it. In closing, though, let's bring Tim Lash from West Health back on for a final few words to wrap us up.
Great. So I guess as we land this plane, I'll first just thank everybody for their participation. But I guess what's running through my mind's eye for this discussion is timing matters. And I really do think that there's the convergence of two distinct forces here. We've talked about there's a lot of tailwinds from action on, the survey results really, yield that there's a shift in views. And at this point, government engagement and meaningful action to lower healthcare costs are apolitical in many ways, at least for the voter. Certainly not on the Hill, but for the voter. And I think that's a reflection of, the COVID has really revealed that health spending really impacts all stakeholders. So we've talked about, I think we're getting a fuller understanding of the economic impact of COVID and the pandemic, both near term and midterm, which is heightening the problem. And there's, I think, a growing realization, given the journey that we've been on, the times at the rodeo, that there's a realization that we can't go at it alone. So there's certainly some tailwinds. There's also a force of the risk of inaction. At this point, the labor participation rate is at its 40-year low. So that might be, some redistribution or frictional redistribution in the labor pool. We'll have to monitor that over the next 4 to 6 months. But it may be that there's just, less workers that are available. And there's a real risk that we return to our old habits, that, paying more and more for healthcare from the employer is just sort of the table stakes. I also wonder whether, that causes employers to rethink the algebra and calculus around investment in innovation or even offshore workforce, which is, something that would have, significant economic impact, to our country and its viability economically. So I think, now is the time that it's really critical that lawmakers and businesses sit at one table together. I think the good news is there's some places for them to start. The H.R. 3, which passed the House in the last Congress, has provisions to extend Medicare negotiation to the private sector. I think that's an example of how we can start to address a market failure with the introduction of government activities, which is how you address a market failure. I think that there's some progress that the government can make on antitrust and how we get at the consolidation. By the way, we've witnessed more consolidation in primary care during COVID than we've witnessed in several years before that. So it's accelerating, which just further puts pressure on employers. But perhaps more importantly, and both all the panelists, John, Larry, Dan, you brought up this concept of cost. Cost is, part of the equation. We make progress there. I think it'll be impactful. But there's also this component of utilization, something that, businesses and even the government has been hesitant to drive after. And I'm hopeful that as we push forward in redesigning our healthcare system, really not just papering over it, but sort of redesigning how we deliver the care, that together there's enough air cover between business and government that we can get at this utilization discussion. So really timely discussion here. I think lots of great perspective was surfaced. COVID has, shined new light on some things, but I think amplified much more. And we need to engage because timing does matter. And I think the window is opening for meaningful reform. So thank you.